Welcome back to Midday Kentucky, everyone. Well, I'm joined here by Dr. Eric Smith, General and Bariatric Surgeon from Georgetown Bariatrics and Advanced Surgical Services. Welcome to the show, my friend.
Thanks.
Now, you gave me a chance to come into your offices and talk to a couple of your patients. Now, on the day, you were doing a educational seminar. Tell us a little bit about that. What happens there?
So that was the day that those patients came in and they were ready to schedule surgery. Most of these patients have been in process for 6, 7, sometimes 8 months, doing their dietary education, their visits with their doctor to document their diet and all the education that we give them, which most insurances require. And that was the big class where I actually explained the surgery, what they can expect, you know, how long they'll be in the hospital, what their visits will be like for the first year. And we spend about an hour and a half talking to them, showing video clips of the surgery and very detailed about it.
So I just want to be really clear on this. Before you get to that class, that's when you schedule the operation, but before that is all the information and education before, making sure you're on the program, because you do talk about dietary issues beforehand, don't you?
Oh, absolutely. I mean, these patients, like I said, have gone through months of education.
Yeah.
I mean, literally multiple visits with our dietitian, with our psychologist, with our bariatric nurses, with myself, with my physician's assistant, in preparation to get them to the point where when we hit surgery, we've given them the tools to be successful. I don't want them to try to change everything at one time and, oh, by the way, you're going to have surgery too.
Yeah.
We need to put those things in place so those become habit, so when they hit surgery date, those habits have started to form.
Ah, that makes sense. What I found really interesting about these two ladies that you're just about to see, everyone, is that it wasn't about these women sitting at home just ordering takeout or just going to the fast food chains and overeating. This is life circumstances that have put them in this position. Do you see a lot of that?
Absolutely. You know, as I always say, we all have our story, but
Yeah.
many of these patients have something that precipitated their issues with weight. You know, maybe it was minor and then it became major. And, you know, I tell patients all the time, you know, and that's why it's so important early on, is I hope to tell you that my surgery will make life better, but my surgery will not make life's trials and tribulations go away. Okay. Holidays will still happen and trauma will still happen, and we have to know how to deal with it.
All right, well, let's take a look at what we filmed.
Went through a bad divorce and lost a parent, lost my father, and gained 100 pounds. And just seemed like I never could lose it.
Why now for the surgery?
I have a young daughter that I had to tell her no on doing something because I was hurting, because the extra weight on my joints caused extra pain.
What are you hoping to achieve out of the education and the surgery?
To be able to play with my kids without having to stop multiple times.
So we're talking life circumstances?
Yes, yes.
Okay, have you tried to diet and exercise before resorting to surgery?
Yes, I've joined the gyms and actually hired trainers and worked out like 4 or 5 times a week and would lose weight and then gain it back.
How did you get to this point?
I was in a wreck when I was younger, which caused a lot of surgeries, and before that I was very athletic, so it put my body in shock because I wasn't activity-wise, and then I became very in love with starch. Lots of noodles. Bread, my favorite food.
Eating the wrong foods?
Yeah, not ever having to worry about weight before, and then just sitting down eating whatever I want. It affects you differently when you're not active.
Being very explanatory about explaining every step, and it's just made it so simple to where that I've made my mind up. That's what I want to do.
And you feel secure?
Yes, I do. I feel secure in him and the facility.
Dr. Smith, what I find interesting here is that there were circumstances, as I was saying before the clip, it wasn't about overeating. What do people expect, not what you guarantee, what are people's expectations of percentage of body weight that they expect? 50%, 60%?
Well, I think early on we set their expectations to be realistic. You know, we asked them, most people oftentimes are underestimating, but most of these patients we should expect to see them lose anywhere from 55 to 60% of their excess body weight in
Wow.
the first year.
That's major.
And we give them numbers and we start tracking that. And because sometimes when people hit a little lull, they get discouraged. And I say, well, look at the numbers. You're actually ahead of the game.
That's me, and I haven't even had the surgery. We appreciate you coming in. Great information yet again. If you want to find out more information about Georgetown Bariatrics and advanced surgical services, there it all is there up on the screen. Guys, head over to their website. They've really got some great information there. Or you can give them a direct call on 502-570-3727. We appreciate you coming in yet again. Everyone, we'll be back after this short break.